Carpals. Introduction. The carpals are 8 bones which are arranged in 2 rows. The proximal row lateral to medial. The scaphoid. The lunate. The triquetral. The pisiform. The distal row lateral to medial. The trapezium. The trapezoid. The capitate. The hamate. Identification. The scaphoid. Boat-shaped. The lunate. Half-moon-shaped. The triquetral. Pyramidal in shape. The pisiform. Peashapet. The trapezium. Quadrangular in shape. The trapezoid. Shoe of a baby. The capitate. Largest carpal bone. The hamate. Wedge-shaped bone. Side determination. General points. Proximal row. Convex proximally and concave distally. Distal row. Convex proximally and flat distally. Each bone has 6 surfaces. The palmar and dorsal surfaces are non-articular, except for the triquetral and pisiform. The lateral surfaces of the 2 lateral bones, scaphoid and trapezium, are non-articular. The medial surfaces of the 3 bones triquetral, pisiform and hamate are non-articular. The dorsal non-articular surface is always larger than the palmar non-articular surface, except for the lunate, in which the palmar surface is larger than the dorsal. The general points help in identifying the proximal, distal, palmar and dorsal surfaces in most of the bones. The side can be finally determined with the help of the specific points. Specific points. The scaphoid, the tubercle, is directed laterally, forward and downwards. The lunate. A small semilunar articular surface for the scaphoid is on the lateral side. Quadrilateral articular surface for the triquetral is on the medial side. The triquetral. The oval facet for the pisiform lies on the distal part of the palmar surface. The medial and dorsal surfaces are continuous and non-articular. Pisiform. The oval facet for the triquetral lies on the proximal part of the dorsal surface. The lateral surface is grooved by the ulnar nerve. The trapezium. The palmar surface has a vertical groove for the tendon of the flexor carpi radialis. The groove is limited laterally by the crest of the trapezium. The distal surface bears a sellar concavo-convex articular surface for the base of the first metacarpal bone. The trapezoid. The distal articular surface is bigger than the proximal. The palmar non-articular surface is prolonged laterally. The capitate. The dorsomedial angle is the distalmost projection from the body of the capitate. It bears a small facet for the 4th metacarpal bone. The hamate. The hook projects from the distal part of the palmar surface and is directed laterally. Attachments. Scaphoid. Adductor pollicis brevis. Flexor retinaculum. Pisiform. Abductor digiti minimi. Flexor retinaculum. Flexor carpi ulnaris. Trapezium. Abductor pollicis brevis. Flexor pollicis brevis. Flexor retinaculum. Hamate. Flexor digiti minimi. Opponens digiti minimi. Flexor retinaculum. Articulation. The scaphoid. Radius, lunate, trapezium, trapezoid, capitate. The lunate. Radius, scaphoid, capitate, hamate and triquetral. The triquetral. Pisiform, lunate, hamate and articular disc of the inferior radioulnar joint. The pisiform articulates only with triquetral. The trapezium. Scaphoid, first and second metacarpal. The trapezoid. Scaphoid trapezium, second metacarpal and capitate. The capitate scaphoid, lunate, hamate, second, third and fourth metacarpals and trapezoid. the hamate, lunate, triquetral, capitate, and fourth and fifth metacarpals. Clinical anatomy. Dislocation of the lunate may be produced by a fall on the acutely dorsiflexed hand with the elbow joint flexed. This displaces the lunate anteriorly, also leading to carpal tunnel syndrome-like features. Thanks for watching. The Meds Vibe.